Hi all, hope each and everyone is doing well and good. And this is me, Dr. Amrita, and video is going to be so fast. And we are going to discuss about the most important topics in biochemistry. And I assure you guys, if you study this much, of course, you will get above 90 percentage because these are the crux of biochemistry and the most important. And if you guys ask me in first year which subject do I concentrate for Neet, I will say that it is of course biochemistry because they can definitely integrate with pediatrics and can ask. So very fast video, I just written everything in my book, so I will just dictate. So we're planning to start with biochemistry. First study vitamins in and out. Okay, vitamins is going to be very important because so many questions, all time favorite. 2023 we have seen around 4 questions from the same topics, so it's very important. All vitamins you should study that. That's B1, B2, B3, B5, all those things, in and out vitamins. So after studying vitamins, go to glycogen storage disorder. Very important, all time favorite. Okay, that carbohydrate disorder, wala, that liver cirrhosis, what is the enzyme, that heart failure, that is Pompey's disease, and all those things. So here you want to understand what is a disorder as well as the enzyme deficiency. Here how they frame the questions, basically the clinical scenario. This you will be knowing now. So that muscle cramps, wala, what happens, that's all clinical scenario, very important. Hemolytic anemia, where you see the torn RBC, that is stories. Like that's very important, in and out. All time favorite is that Von Griggs, and also that's McCardle. That's very important, so never skip it. And other carbohydrate disorders, that galactosemia, aldolase, and all those aldolase B and all. So they will be put in with clinical scenario. So never ever skip it. Okay. Then study about all those lysosomal storage disorder. That comes your Couch's, Tay-Sachs, name and pick, all time favorite. So here you want to study the enzyme deficiency as well as the clinical scenario. How they ask Tigrodon MRI brain, where do you see? That is metachromatic leukodystrophy. So what is the enzyme? RL sulfatase A. Very important. So these kind of questions. So form cells, zebra bodies, where do you see? That is a name and picks disease. Very important. So after learning this, I will say to you, just go to the enzyme cofactors, because every time there is a question. Enzyme cofactors, that is zinc, voila, 1 minute. Manganese as well as the magnesium, that's all, that zinc, that is carbonic anhydrase, carboxy peptidase, all those enzymes. That is copper, what all enzyme like tyrosinase, cytochrome C oxidase. That selenium is always favorite. So that is glutathione peroxidase. So create some mnemonics and learn. Very important. That's lysyl oxidase. What is that? That's copper, tyrosinase, copper. All those things very important. Please never skip. And also the niacin wala, that is B3, that is NAD is there. So riboflavin, F wala. So this thing, all those things, that is FAD, that's all. Never skip it. And after that, go with this kinetics, that is a competitive, non-competitive, and all those things. See what happened, that whole graph wala, what happened to the KM, what happened to the Vmax. That is very important. So after learning that, go to the difference, that box wala. See what is the enzyme you get seen, fed state, fasting state. That is very important. See, fed state means what? High insulin and glucagon ratio. So what is the enzyme there? There is glycogenesis. And in fasting, what happened? Low insulin, glucagon ratio. So what is the enzyme? Or gluconeogenesis. And there is a beautiful table, very important, all time favorite. Okay. So that you should learn. And enzyme inhibitors, that I already have said. Competitive, non-competitive, all examples you should learn. Then the most important is a cholesterol wala. See cholesterol, every time there is a question. So that chylomicron, that is type 1, type 2, 3, familiar hypercholesterolemia. That's all things. Please never skip it. Then study about the ETC inhibitors, because every time there is a question, that is what, that complex 1, complex 2, complex 3, 4. So what is the enzymes there? So where do you see the cytochrome C? where is getting inhibiting, that is very important. That all things like complex 1 is what, rotin 1, amobarbital, peroxidin A. So that's all you should learn. So, complex 3 means what is that? Complex 3 is that bal wala. So they'll be giving where do you see, that's very very important. Oligomycin F0 F1, that's all thing, because 2022 they have asked similar questions. Please never skip it. And also that pathway wala na, that in enzymes, what all the enzymes inhibiting, like Krebs cycle, what is that, isocitrate dehydrogenase, please read that. Okay, de novo, what is that, urea cycle, that's all, just read and go. Not that much important, but just read and go. So let me check, did I miss it any of this? This is all I have explained. That metachromatin, Graves' disease, what do you see? Tiger eye, that is the tissue paper thing, where do you see? Crumpled. That is all time, every time they are asking that. Amino acid derivatives is important. Say melanin, what all that come like tyrosine, that's all things very important. Urea, what is enzyme? Arginine aspartate. Creatinine, what all the enzymes, methionine, arginine, glycine, all time favorite. Please never skip it. And also, yeah, cabbage order, urine, that's burned sugar order. Ochronos is very important, black urine on standing, because every time there is a question, so that you want to find with the clinical scenario, they will be asking alkaptonuria. See what is the enzyme, that's very very important. Okay, and also study the treatment also, they might ask. Okay, homocystinuria, that is followed vitamin B12, just read and go. Okay, then vitamin I have already explained. Vitamin mineral is very important. Zinc wala, that's very important. Lysyl oxidase, where do you see, that is very important. Wilson's disease, and very important that child, that is acrodermatitis, zinc deficiency diarrhea, that is very important. Then yes, lipoprotein already I have explained, very very important, must know topic, that is VLDL, that is ApoB 100, that's all. And also I have explained that familiar dyslipidemia, that is type 2, type 1 chylomicronemia, that is what is a deficient, what increases, that triglyceride and all, there is so many things. Please learn it, okay. Then A beta lipoproteinemia, study the base of biochemistry, what is a defect there, okay. Defect is in the microsomal transfer protein. So what is a presenting complaints and all? Infant with steatoria, you can see retinitis pigmentosa, acanthosis, very important. And genetics, at last just read and go. What is southern, that's DNA, northern rRNA, western protein, southwestern means what, that's all these things, steps and the enzyme. So point mutation, silent mutation, what is about missense, nonsense, all time favorite. Frame shift mutation, just do MCQs and practice, okay. In this thing, genetics, you want to do MCQ and practice. See, biochemistry is actually going to be a very very scoring subject. They can, again I'm saying, they can integrate with an us, so never lose a hope. Yes, time is there, this is your battle. Never ever think about any of the negative people, this is your life, and enjoy. And it is me, Dr. Amrita here, and thank you guys, thank you.